Hello everyone, myself Poornima, currently pursuing Masters in the Department of ARGO from Veterinary College, Bidar. My topic of discussion is MRP, Maternal Recognition. So before an embryo goes and attached to the uterus, so these are the four critical steps that takes place. Development within the confinement of zona pellucida, hatching of blastocyst from the zona pellucida, MRP, and then formation of extraembryonic membrane. So what is MRP? So these are a critical series of events by which the conceptus initially signals its presence to the dam and enables the pregnancy to continue. And why this MRP is required is mainly to prevent the luteolysis, so that CL will persist and pregnancy will be continued throughout the gestation. So there are different MRP factors and different critical periods for different species. In case of ruminants, the normal CL, if there is no breeding, the CL will secrete the oxytocin, which will act on OTR, oxytocin receptors on the endometrium, which will cause the release of PGF2 alpha and cause the CL lysis. But if there is a breeding and fertilization takes place, the conceptus has a trophoblastic layer, and from this layer, the IFN, interferon tau, is being released, which is an immunological factor. This IFN, interferon tau, which will block the or inhibit the oxytocin receptors, and there is no PGF2 alpha secretion and CL will persist. In case of Eve, we call it as a ovine interferon tau at the day of 13 to 14 after fertilization, and in case of cow, it is bovine interferon tau at the day of 15 to 16 after. In sow, there are two different points of the factors. One is estradiol, which is being secreted by the conceptus itself by day 11 to 12. And under the influence of this estradiol, there is a rerouting or the change in the direction of the flow of PGF2 alpha into an uterine lumen. In the uterine lumen, this PGF2 alpha is having no action or a little action, or it will get destroyed, so that the CL will persist. In case of male, the presence of conceptus itself is an MRP factor, which will undergo a transuterine migration for about 12 to 14 times per day from on the day 12 to 14, so that it will block the PGF2 alpha secretion from the endometrium, and the CL will not go any kind of lysis. In women, HCG, which is a LH-like hormone, nothing but which is having a luteotrophic effect, so that the CL will function normally without undergoing any lysis by day 7 to 12, so which will inhibit the intra-ovarian luteolysis. And in case of bitch and queen, it doesn't require any kind of signal from the conceptus. So bitch and queen, it doesn't require any kind of signal from the conceptus, because in case of bitch, the lifespan of CL is equal to that of gestation length, whereas in queen, it is an induced ovulator. So there is no CL if there is no. So to summarize, a successful pregnancy requires a pre-attachment embryo development into a blastocyst, and then it will get hatched from the ZP and develop into a functional trophoblast. And the early embryo must secrete the materials which will prevent the luteolysis or which will enhance the luteal function to maintain the pregnancy. And the overall MRP is being summarized into the table with the different species and its respective MRP factor and the critical period. And these are the references.